Effects of selected dietary component on drug. We have learned about drug interaction, pharmacodynamic drug interaction, pharmacokinetic drug interaction. When we take drug with fruit or vegetable, there will be interaction. Sometimes it occurs and may cause pharmacodynamic interaction also. Effects of selected dietary component on drug, we will cover vitamin K rich food, potassium rich food and supplement, high protein meal, tyramine rich food, calcium rich food and fiber rich food. So, what is this? Okay, vitamin K. Effects on warfarin anticoagulation. Warfarin inhibit the synthesis of vitamin K-dependent clotting factor. So, it is advised to take dietary intake of vitamin K-rich food should be consistent to avoid fluctuation in INR. So, what is INR? INR is used to measure blood tendency to clot. So, this is example of top 10 food highest in vitamin K. I take this from website of Jabatan Farmasi Hospital USM, so you can check further when you go to the website. Next. Okay, potassium drug interaction. Drug for hypertension and CVS, cardiovascular system disorder, for example, ACE inhibitor, potassium sparing diuretic, and angiotensin receptor antagonist. This drug can cause retention or accumulation of potassium. So, ingestion of potassium-rich food should be in moderation to avoid risk of hyperkalemia. So, this is example of top 10 food highest in potassium. Another example from website of Jabatan Farmasi Hospital USM. Okay, what is this? Protein. Protein drug interaction. The influence of protein containing meal on the pharmacokinetic of levodopa in healthy volunteer. Why? Because reduce competition for levodopa transport across the blood-brain barrier. So, protein with the drug levodopa, which is used for Parkinson's disease. High protein meal reduce cerebral uptake of levodopa because of competition for transport and may reduce clinical efficacy. Therefore, take the drug 30 to 60 minutes before a meal. Top 10 food highest in protein. Okay, then tyramine. Look at this picture carefully. So, tyramine drug interaction. Tyramine, amino acid synthesized in the body from the essential amino acid tyrosine. It stimulates the release of the catecholamine, for example, adrenaline and noradrenaline. Drug for depression, for example, monoamine oxidase inhibitor, cause accumulation of catecholamine because increased risk of hypertension crisis. This is the tyramine interaction with monoamine oxidase inhibitor. So, food high in tyramine. People taking monoamine oxidase inhibitor should avoid the ingestion of food. Example, aged and fermented food and beverage containing tyramine. So, calcium. Calcium drug interaction, for example, antibiotic like tetracycline and quinolone. Chelation and reduce drug absorption with a risk of therapeutic failure. Precipitation or complexion or chelation. Chelation, for example, antibiotic ciprofloxacin and norfloxacin, drug for osteoporosis such as alendronate. So, we advise to take with plain water. Top 10 food highest in calcium. So, what is this? Okay, fiber. Fiber drug interaction. For example, drug for congestive heart failure, digoxin. effect reduced bioavailability. So we advise avoid concurrent ingestion with fiber containing food. So top 10 food highest in fiber.